Thank you very much, Professor Smith. So I'm going to open the forum, the questions for the forum to Professor Riley, Lee, or Smith. Are there any questions? The forum is people sitting at this table. Yes, Peter does that.
Hi, really interesting session. And I wanted to first ask, do you guys work together? Do any of you work together? No, I mean, that's interesting. So it's good that you're here together, because clearly, so, you know, thinking about the built environment work, we tend to look at these diseases from the funder's viewpoint, don't we? We look at the risk of pandemics, and we're all paranoid about traveling on airplanes and going to hotels after SARS and avian flu. So it's sort of interesting that the risk is funded to look at that sort of built environment, whereas really perhaps the greater interest should be to focus on the built environment in slums and look at what the fomite risk is there. So one question is, are people doing that? Are we beginning to use that high-tech science approach to look at slum habitats for pathogens? And the second question is, you know, thinking about your work, David, and the sort of change in patterns that you've identified at a macro scale, succession of cities, very interesting idea. Where do slums fit into that, and does that make sense to you, Lee? I mean, how does that work? Are slums a sort of, because we see in that classic picture of the Sao Paulo slum right next to a high-tech, beautiful apartments, they're juxtaposed against each other, so how do they fit together?
I'll just take a shot at that. When I was when I first went to Ecuador, a few years before I got there, they had named the Guasmo the biggest slum in the world. This was 1982, and it was National Geographic. By the time I got there, so it was created by an invasion. A bunch of poor people who didn't have places to live went into an area and squatted, essentially. And they had power lines because there was a shipping dock at the south. Big, massive power lines went from the city down to the dock, and people threw wire up over the power line, and they stole power. And at first, the city resisted them and came in with bulldozers and tried to get rid of them and stop it, and then they realized they couldn't do it. And so by the time I got there in 1986, there were very well-developed roads. They started building sewage and drainage for these people. They had built power lines, and they were starting to build meters so they could charge them for the electricity that they were using. And that transition happened over a very quick period, a 4-year period. So I guess if you were to go into that area and talk about fomites and infectious disease transmission, you know, the number of things that were in the Guasmo at that time affecting those people, there were so many things that they didn't have. You know, there was high crime, it was no sewage disposal, no fresh water. And by the time 4 years later, some power, sewage disposal, rudimentary drainage, and all of those kinds of things. So I think what I'm talking about does actually happen. It's just that maybe it arrests at a certain stage when there isn't enough wealth to keep doing the drainage and improvements that are needed for some of these communities. But I think in terms of sort of, is there, it's not just research, it's development in these places can happen. It can happen very quickly and take care of some of these problems that evolve so that problems, you know, don't affect everyone. And it's not just a funders versus the rest of the world. I mean, nobody wanted the kind of stuff that was going on in the Guasmo to happen. It wasn't very nice. And so, and the stories that leaked out and the crime that was coming out of the Guasmo was affecting everyone. So there were a lot of incentives to do something about it.
The first question was about interventions. Is there something being done about slums?
Well, the first question really is, can you apply this sort of approach of looking at fomites and air circulation and pathogen transmission to a slum? Is that being done? Because that could be interesting. The second is there a mixture between these two sort of model cities in modern day slums?
The right hand side.
I'm really sorry that I have not worked on slums, and if there's an opportunity, very much waiting to. I think to understand what's going on there. It sounds interesting to me. It can help a lot of people. But I have reviewed some proposals in the past. People propose to study, doing simple measurement like a CO2 in those buildings and see what was happening to the air that they inhale. Of course, access to water. There's a lot of studies. Hand washing. They don't have access to water for hand washing. So, interesting to see that the underaged children, under 5 years old children, have more than 30% due to respiratory infection, and something happening in the homes where they live. So, really need. I feel the need, but it's just hopefully I have another life.
What proportion of we know what proportion of the population live in cities. Do we know what proportion live in slums of the urban people?
No, it's about 28%. It's about 28% globally. It used to be higher. It's decreasing, but depends on the country. And depends on the city within countries. But just to kind of follow up on Dr. Lee's point. So there are researchers who do this kind of work in slums. I don't do it myself, but I collaborate with people who do this. And I think Jason, is one of the people I think who may be able to discuss that in more detail when he talks. But there's Kirk Smith, who studies indoor air pollution from cooking, using biofuels, and he used to do that in rural areas, but he's applying that to urban slums. And so there are researchers looking into this issue. But those only address the issue of exposure. But as I was pointing out, it's ultimately the pathogens that determine the health outcomes. And I think we need to really get at the issue of exposure and the sort of the mechanism of these pathogens that lead to these outcomes. So that's where we come in.
Are there more questions from the forum? If you can, please tell your name and the institution you come from. And press the right
Thank
button.
you, David Nabarro, formerly with the United Nations. Thank you so much for the presentations. As you were talking, I was thinking, are we going to be able to come across any comparative studies that look at incidence rates for particular diseases in different urban settings? And I suppose it's pretty difficult to do. And then I thought, well, what about looking at the same urban setting at different times of year? Are there helpful studies by seasons? That's really just because I'm not myself very au fait with the literature. And secondly, is there any material on incidents linked to the occupation of people living in these very trying conditions? For example, if you are working as a rubbish picker, are you more likely yourself or the young rubbish pickers to suffer illness compared with if you are not in that occupation or if you're working in other occupations? Or is this a question that just displays my complete lack of understanding of what life is like in these settings? Thank you.
Let me attempt to answer those questions. So your first question. So we ourselves have used the health metrics method of IHME, DALIs, to assess the burden of disease in particularly tuberculosis in the city of Rio de Janeiro. So we're looking, and you're right, it's very difficult to do these kind of studies, but it just happens that in Brazil, they did, in the last census they used the UN definition of slums to categorize different neighborhoods into what they consider to be slums and non-slums. And we looked at the burden of TB in the non-slum versus slums, and we found very interesting differences in terms of what we call DALI gap. So we calculated DALI gap according to gender, demographic characteristics, whether there was electricity provided into these communities, water services, sewage services, et cetera. And by doing that, we're able to get granularity to how this disease contributes to in the same city in the two different types of neighborhoods. It's much better than looking for incidents. So actually, you can actually quantitate the quality of life in these communities by using DALYs. So you can actually apply DALYs to local cities. And so that's one. There are not that many studies because they can only do this if the government has a very good census to describe communities into what's considered slums versus non-slums. And to answer your second question, I think Albert Ko may be able to address this better. And certainly, occupation contributes to the different types of health outcomes. In Brazil, where in the slums where leptospirosis is highly prevalent, that's certainly associated with type of occupation. Males tend to have higher incidence of leptospirosis because they probably spend time outside more in different types of occupations. They get, have exposures to contaminated water, bodies of water. And so, yes, occupation clearly plays a role in these different types of infectious disease outcomes.
Just before, were you able to study seasonality in Rio de Janeiro?
No, we have not studied seasonality yet. Yes, there's different seasonal patterns to different diseases, but we have not looked at that. Just one more thing that I should mention. Dr. Eza mentioned the interpersonal injuries as one of the major contributors to health outcomes. And when we looked at the DALYs for TB, we found that the DALY gap was reversed among young adult males in Rio de Janeiro. And what we discovered was that the reason this was reversed, meaning that the DALY was higher among the non-slum community young adult males. And the reason for that is because the young adult males in the slums are all incarcerated or they're dead from interpersonal violence. So we could not get that information. That's why this was a kind of a false reversal. But so by doing this, you can really assess what's really going on, not just in terms of infectious disease, but all the other things that contribute.
I think these are two interesting questions on the seasonality. In people studying, those people studying influenza, I think there's a interesting thing that people study. But seasonality, you talk about climate, atmospheric conditions, temperature, humidity. Very interestingly, the built environment that we are focusing today, that because people spend a lot of time indoors, so actually it's the indoor conditions that probably determine some of the things. So for influenza, unfortunately, we do have good data for outdoor conditions. The weather monitoring stations constantly provide us with data. But indoors, so diversified, actually the data are not there. So I know there are people trying to do something. Hopefully in future, some new data comes. Occupation. Some time ago, I became interested in MRSA because of fomite. And I found out that the community acquired infection is very important for MRSA, and in New York and elsewhere. But in Hong Kong, there was also good data. And then, interesting, the data shows we have, I don't know how many domestic helpers. I think 200,000, 300,000. Somehow their infection rate were quite high compared to the general community. So domestic helpers, I feel, is as important as healthcare workers in hospitals and husband in other homes, because they do all the cleaning and they do all the work at home. So they become important. But unfortunately, my proposal was rejected by a funding agency, so no study.
So I think everyone knows about sort of rainfall and temperature and the association with mosquitoes and malaria. There are two bits that are really fun in Nairobi. There's a blip of cases in Nairobi right after Christmas, after everyone's gone home, and then come back into the city, you get a lot of cases. And then the other one becomes very important are the patterns of seasonal migration, particularly around the Sahel, as people move from, as it dries out and they abandon their farms and come into the cities to work, they bring with them a lot of malaria. So there are migration-driven patterns of malaria as well as seasonal transmission-driven patterns of malaria.
Ava Harris.
Hi, Ava Harris, UC Berkeley School of Public Health. I just had a question. I was in your the two cities piece, like 80s, for instance. You had it. I couldn't tell if that it was being limited or it was still present in the sanitary city, because you definitely have 80s, and that is like dengue is a disease across socioeconomic borders. On the other hand, you definitely have much more in slum areas because there's so many more breeding grounds. So that I wasn't sure whether that meant it wasn't also in the slum area, but I would say that those kinds of infection, especially that mosquito that grows around homes, is very much an issue and a risk factor in the kind of slum environment, although it can cross borders as well, I mean, socioeconomic borders.
So I would defer to you on that question. But I will say that overall, this pattern of sort of malaria being replaced with dengue has been pretty robust. Mexico had a massive outbreak in 94, 92, and then steady declines, and now there are 20,000 cases, or last time I checked, 20,000 cases of dengue and about 2,000 cases of malaria in the whole country, right? It's very
Definitely
robust.
for the replacement, I just think that, anyway, yeah.
No, I mean, I don't actually know as much about the distribution of dengue, or of 80s within the city as you two, so I'm going to let you two be the experts on that.
Yes, Edward, you?
Good afternoon. Edward Yu from the FBI Weapons of Mass Destruction Directorate. Thank you for your presentations. For the panel, I wanted to turn the theme on its head a little bit, focusing on urbanization, and you mentioned the controlled environment. We're looking at this as, looking at transmission of disease, the pathogens. It's the perturbations of the system. What I'm curious about is looking at the system itself, meaning that as we become more modern, as the cities become more built out, we are looking at increased incidence of obesity, asthma, because the controlled environment, the age of hand sanitizing. Are we becoming more immunologically naive as a result of becoming more modern? And does that set us up for failure in the future? Because we're looking at the opposing adversary, whether it be the challenges, whether it be migration or the evolution of pathogens. But looking at the population itself, are we setting ourselves up for failure and not realizing it? And just wanted to get your perspective on that from that angle.
I can stab at it. I think this, what you're asking relates not just to people who live in the slums, but I think just all the population in general. But certainly, I think the impact is greater in the slum population. So, we're seeing increase in obesity in these slum communities, especially in places like India and Brazil. And I think that probably has to do with changes in nutrition, but also, as someone mentioned, overnutrition. But I think there's more than that. I think the use of antibiotics and the exposure to antibiotics in the environment and the food that we eat and the water that we drink have altered our intestinal microbiota, and that's changing our body physiology, and that contributes to diabetes, as was mentioned, and that, of course, leads to all kinds of infectious disease health outcomes. So I think there are mechanisms that we can actually begin to study in how the sort of modernization of our food habits and globalization of food trade and the change and all the consequential changes in behavior, health, eating behavior, I think are definitely have an impact on our immune system.
Right. So.
And the microbiome.
Right.
Yeah, that's right. They just know. Right.
So that's what I mean, is that it's not just a slum issue, but as we grow in affluence, does that make us more vulnerable, basically?
Yeah, I totally agree that we have an excess of wealth that, I mentioned that contributes to adverse health outcomes. But I think the impact is greater in the slums. So.
And we have Louise King.
Thanks very much. Great presentation, so really appreciate it. So, David, maybe this is more for you, and it has to do with this migration and a movement of people and microbes back and forth. So one of the things we, obviously see with an increase in number of people in slums is real numbers, is the increase in food needs. You didn't say much about that, and maybe that's not measurable or something you've actually worked on, but the whole structure of agriculture is also changing as people move into urban settings, just because of cost. And so food and agriculture are moving closer and closer, and some of the movement from workers are still from agriculture communities back and forth, which would worry a little bit about zoonotic diseases, but also are foodborne illnesses. So I don't know if any of you have looked at that, but the last time I was in Rio, there was a huge problem in foodborne outbreaks, and that increasing, and especially with this shifting back and forth. So any comments about that or any of your experiences?
Just to say, I haven't studied that very much. I would point out that just to the earlier thing, I do think it's important to remember that people are getting healthier. It was either Alex or Chris that said that. Overall, the disparities are growing, but they are getting healthier. Yeah, I don't know about food security. I haven't thought about those kinds of issues in transport very much.
I can't see your name, but
Thank you. Marcos Espinal from PAHO, Pan American Health Organization. Professor Riley, I was struck with your last statement that, and I'll be grateful if you comment a little bit further on, we cannot wait for the SDG, we cannot wait for, and we need to act now. But to me, you show a photo of 100 years ago and 100 years later, and I don't want to, my generations to come 100 years here again and show another photo, you know. Is there any proposal beyond of what the UN Habitat is proposing in his last conference in Quito, when they concluded that the current urbanization model is not sustainable anymore, that is highly costly, and that we need a new agenda on urbanization, basically, and Chris mentioned upgrading slums. So is it that we need to advocate more with governments to ensure that they take care of the slums? Because in some of the slums you work, in Rio, for instance, people can't, some time ago, people cannot even go into the favelas because they need to negotiate with the, so, and what we have seen in the three presentations before and yours is a systemic issue that involve, there are health-related issues, but also systemic issues beyond that. So I wonder if you can further comment on that, because I was struck with that statement that, because it's not going to be a project of 1 year or 2 years.
Right, right. No, the statement that I made at the end was really just to be provocative. And, you know, it's a difficult question. I don't have any answers. But I think during this workshop, I think some of the issues that I think you raised will probably be addressed. I think, you know, there's something that people like Jason Coburn addresses. I just focus on the biology because it's easier. But sometimes, you know, I admire Dr. Dai, who went away from doing biology to do these kind of things, but I don't have the training or the background to be able to do that. But I think that those issues will be, I think, addressed maybe in this workshop later. So.
Jennifer, then Thomas, then Mary.
Jennifer Gerty from the BC Centre for Disease Control. My question is a much more technical one. I think it's probably best addressed by Lee, and it's, are there slums in high-income countries? I'm thinking of settings like maybe the refugee camp in Calais, or perhaps that's too temporary to be considered a slum. Looking in my own home in Canada, I could imagine things like Vancouver's downtown east side, or even some of our First Nations communities at Awapiskat, for example. Are these considered slums or not?
So the largest slum, using the UN definition in the United States, is located in Los Angeles. And so, yes, they are. I'm not exactly sure where in Los Angeles. I think it's near the sporting complex. But yeah, so yes, there are slum communities. You know, Brazil is considered a high-income country now. And you know, it depends on what part of the definition of slums you use. Yes, you see elements of those parts of the definition of slums in many cities in the US, as well as Canada and Europe. And so Paris is a huge section that I think most people would consider to be slums by the definition that's used. So, yes.
So I have a question for Lee. And I may have misunderstood. If I did, you correct me. But you seem to take some exception with what Chris Dye said about the global sustainability goals, and that's a longer-term solution, and you were looking for something that would address the issue right now. But it doesn't seem to me that those are mutually exclusive. And so I wanted to give the group here a chance to think about how those things could really work together, because I think we all can agree that if, for example, you could improve people's housing, their sanitation, their water supply, that would be advance in terms of health. That will take some time, but there'd be a lot of advantages to that. While on the other hand, I do agree with you that there are some immediate problems that need a solution. We had an example with the Zika outbreak, and really all we could rely on is vector control, and we're really not satisfied with how well that would work. So there are some real challenges there, but maybe an opportunity to just provide a little bit of context there about those two different strategies.
No, I didn't mean to disparage the Sustainable Development Goals. Excuse me. No, I totally agree. And I think Sustainable Development Goals are really something that we need to really look forward to as a kind of a guideline to achieve, I guess. But at the same time, there are immediate things that we need to pay attention to. You know, you always use the example of someone getting hit by a car in front of you, and the immediate response is to try to do something for that person who just got hit. But maybe long term, you need to do something about the traffic control and other things that will prevent this kind of motor vehicle accident. So I think both types of activities are necessary. And yeah, I don't mean to negate the importance of sustainable development goals.
Mary Wilson.
Thank you to all of you. This is for Professor Lee. In many outbreaks of infectious disease, respiratory infections, such as SARS and examples with MERS, there have been a few individuals who have been identified as super spreaders in some of the studies. Do you have any insights on whether this is, whether there are host factors, whether there are environmental conditions, what might be some of the circumstances that would lead to really disproportionate, where there will be a few individuals who are responsible for transmission of large numbers of cases?
I happen to study, I'm relatively bio-ignorant. However, I still tried study after SARS, something called the super spreaders. And it was eventually referring to as super spreading events in my paper. But somehow this terminology is not widely accepted. And this simply because the observation in some of the outbreaks of SARS that it was environment which magnify the sources. It's interesting to see. And it was also interesting to compare, some years ago, I wrote a paper in American Journal of Epidemiology with some people that analyzing the super spreading events in Singapore and Hong Kong. And it was amazing that in Hong Kong, that each event probably produced an order of magnitude greater number of the infected than in Singapore. It's difficult to tell whether it was due to the host factors or due to the source index patient or due to simply density of people or either people or buildings. Yeah, so I guess this was repeated, unfortunately, in Seoul for the MERS outbreaks, and which I visited one of the hospitals, which I've seen is just happened that room was the engineers forgot to install the air supply in that particular room. And that's it. So very, very simple reason. Yeah.
Ava Harris.
Yes, thank you. Yeah, I just think this is incredibly important and profound, both the layers that are emerging in this that actually Lee and others have been looking at for a really long time. But in terms of the intersection between the actual biology and then upstream factors and the whole conditions of slums. So, I mean, one is like obvious kind of health access, okay. But then there's others, like for instance in the Zika, I don't actually think that it's necessarily the mutation rate of the virus in such close contact, just because dengue doesn't tend to and Zika, meaning flaviviruses, in terms of the mutation and the rate and the clades are not as specific as like across fences. But there is emerging data from Brazil and other places that SES, so socioeconomic factors, status seems to have a big impact on like microcephaly outcome. Now that could be from sociological factors like access to abortion or something like this, or it could be, you know, an effect on nutrition, and nutrition can affect the immune system or the microbiome, and then that can then affect the disease, for instance. So I think that it's just a fascinating and really important area to sort out, you know, what are like direct risk factors, and then how the risk factors can work through biology and through the immunology out into the outcome of disease. You know, so I think it's really exciting area to be putting together those different aspects, and I just applaud this, and I think it's a really important area.
I want to ask a question to the speakers. If we could imagine the world in 100 to 200 years from now, and we are optimistic and we think we have at least partially solved the problem of inequities, and we have improved the slums, but at the same time, we will be living crowded in centers where we produce our food. We will have urban farms and agriculture. And the fact that the human microbiome is being degraded with urbanization, what is the future for, what is the responsibility for urban planners and architects in terms of predicting and doing something about the future microbial diseases in future cities?
I have a very dark future vision of the future. I think we're going to see this issue with urban slums get a lot worse before it gets any better. I think long before we see the impact of things like climate change, we're going to see the impact of these slums in public health and in the rest of the world. I don't think we have really good, concrete, immediate solutions that at least I can see. But I may be wrong. Maybe others may have.
Are there any of the panelists more optimistic?
I think I have to be. No, I am. I think human will be smart enough to find the solutions and I have another interest of research on urban climate. I do believe look at what's happening in China now. The cities becomes very big, and people can move from one city to another by high-speed rail. Unfortunately, this mobility also allowing microorganisms, microbes to move. So sometimes I also look into the future architecture, a little bit in talking to students. I think human being will be able to find a better form of cities than today. And sometimes I feel Hong Kong is too crowded. And so there might be a better form. Yeah.
I tend to look at these things from a process-based perspective, sort of trying to figure out how slums form in the first place and what makes them persist or break up and go away. And I don't see those processes changing. So I think that we might have different slums, but we'll still have slums. That's my view.
Now the questions are open to everybody outside the forum or in the forum. Oh, I'm sorry, Jennifer again, and David again. We should leave some minutes for the rest of the people too.
Mine's just a very quick comment, less of a question. Based on Eva's statement and yours just now, it might be interesting to think about the intergenerational effects of slums on health, thinking about the developmental origins of health and disease and how impacts on maternal health are felt in subsequent generations. I think it's something you could probably do now, looking at the children of parents that were raised in slum environments, but the children themselves aren't in those environments, and just taking a look at those sequelae. Just an idea for the parking lot.
David?
Thank you. There's a remarkable book, I've forgotten the author, called In Praise of Slums, and an article that was written in Foreign Policy with the same title. Why slums? Because they're much nicer than a really bad rural existence. And with climate change affecting possibilities of production in so many parts of the world, it's likely that movement to cities will increase rather than decrease. And that means that what we describe as slums, but which is really an incredible refuge and haven for people who are escaping real poverty in rural areas, will just increase. The question is, what is the prospect for mayors of big cities to actually improve slums? And I think most of you, and certainly me, who've ever worked to try to help get improvement in conditions of places like Kibera, the situation is straightforward and rather stark. If you're a mayor, you do not want to put in drainage and improved housing into a slum area because you do not want the people who are there to become permanent residents. And so there is a real pressure against it. In many Indian slums, actually, this land is often privately owned, and so there are other reasons why it can't be done. So I think that, although I think that your point, Maria, is a good one, that wouldn't it be nice if there weren't slums, I think the alternative is to say that for the future, we will need collectively to plan for more people to move into cities in search of work and opportunities, and try to find ways to enable them to do this without having to live in squalor.
Your question raises the point, are rural poor worse than urban poor? The data we saw before suggests the opposite, but do you have comments?
So I think Dr. Easy gave a nice discussion on that point. So if you compare to the slum populations in urban conditions, they do a lot worse than the rural people. And so you can't just equate just poverty with urban health or slum health. They're not the same thing. And poverty is not necessarily related to slums. Slum has a very distinct set of conditions and health outcomes. I think that really has to be stressed. And so if you just look at that, then yes, people in the urban slums do a lot worse than people who live in rural areas. But overall, so these data are usually aggregate data. And so that's why when you look at those data that way, then it looks like the people who live in urban settings do better off, they're better off than the rural. But that's not really true, because you're comparing apples and oranges here. But to the point that Dr. David was raising, I think the discussion that Jason Corbin will present will address that issue, because it's just sort of, what do we do with these slums, as populations increase. In places like Brazil, they try to make improvements within the slums, so in situ improvement. And so instead of bulldozing these communities away, they will actually try to build from what already exists. And people from different parts of the world will actually go to Brazil to study this phenomenon, what they're trying to do. And so, that might work. I don't know. But
that's true also in Medellin and other
Medellin
cities.
is another place where they're doing.
So we have a question from Peter, and then I would like to open 2 questions at least before the time is over.
Just a quick observation on this. what's life like in the rural area versus life in the urban area. I just think we have to be a little careful about disaggregating the urban stat to give a slum one and not disaggregating the rural stat, because the people who come may come from the worst bits of the rural area. But my question is actually a slightly different one, which is, if you accept David's assertion, which I think is probably right, which is that we're going to end up with a lot more urbanization and a lot more relatively poor people coming into very densely. Are we studying, do we understand what are good models? I mean, we've been discussing some bad models, but some good models of, at a low-cost way, absorbing large numbers of relatively poor people in a very dense urban environment? Or is that a problem we still have to crack?
So it really depends on what you mean by a good model. Models are models, and we don't
There
know
may be less worse models.
But you don't really know that until you see the impact of those models, right? And places like Brazil, they reduced poverty rate by a huge fraction during the Lula government period. But in the last 2-3 years, it's just everything's getting reversed. And so all those programs that they instituted are getting cut back. And so maybe was that a good model? But the models could also be changed by totally unpredictable political and economic circumstances. So it's really hard to assess what is a good model or a bad model. I think only time will tell, and if they're sustained for a long time, maybe then you can say that was a good model. And also, not all slums are the same. They're very different. No matter where you go, even within a country, even within the same city, slum communities differ. And so a model that works in one place may not necessarily work in the other. When they started these slum upgrading programs in certain neighborhoods in Rio, many of the gangs moved away from those places and went to other neighborhoods. And then the neighborhoods that used to be relatively safe have now turned into these crime-ridden communities. And so it's very complicated. I don't think we're ever going to be able to say that's a good model or a bad model.
So Lula may come back and compete in elections again in Brazil. What about China? China had the biggest migration of rural people into cities in the last years. 200 million people move. So could that be a model in any way? Could we learn from the Chinese?
I have not studied, but while you were talking, I was thinking, and when I studied in Shanghai, and someone in Hong Kong supported the university to build a high-rise building. I still remember as a student stood up there looking down those streets, and it's not different from those photos people have shown early on, and people discuss how long it would take for those houses down there be replaced by this one. By calculation, it would take another 50 or 100 years, actually. It was not possible. But now it's all gone, and the area where I studied became one of the most expensive location in Shanghai. I think a lot of things to do, although, something to do with how people will work together, and somehow China succeeded in improving that situation. So urbanization is very rapid. So that's why I've seen how they develop, and I show some optimism in terms of collective wisdom.
So 2 questions from non-forum. One over there and one over here. If you can be succinct and fast, because we are on our coffee break already.
Hi, my name is Parton, and I come from Yale School of Forestry and Environmental Studies. I have 3 questions which are very much related, and these have emerged from the discussion that I've heard so far.
Can you be brief if you are going to ask 3? If you could ask 1, that would be better.
Okay.
Sorry.
So the question is, to what extent does the panel feel that our urban-rural demarcation is limiting our understanding of human settlements at the planetary scale? And if our focus should be on the urban continuum or the rural continuum, will it fundamentally shape our understanding of health risks? Thank you.
The only thing we did with this was a study where we were trying to find if we, at what scale would urbanization affect the ecology of phenolphthaleins and transmission. And we found in our low transmission setting in Jinja that a very local scales pavement was negatively associated with, if you had more pavement, you had fewer mosquitoes. But we didn't get into the morass of trying to clarify what we meant by urban. We just used the accepted definitions of high population density.
Thanks. I just want to add a comment on what works in response perhaps to Peter's remark over there. I think we know a great deal about what works. I mean, you mentioned the Lula era. In that era, a great deal was done in Brazil to understand, for example, whether community-based health insurance schemes work, whether cash transfer schemes work. And there are many, many other initiatives of that kind that were investigated by research programs that shows what works and what doesn't work. The challenge is to take those things that we know work and actually implement them, because we know that they'll do good. We've seen that in Brazil, and as you said, we've seen that they're being reversed under alternative policies. We do know a lot about what works. Let's see if we can implement it.
Thank you very much. I want to again thank the three speakers for these wonderful presentations and discussion.
Let's return in 15 minutes, so let's say 5 minutes before the hour. We will start.